I recently met a woman named Shytei who was able to decrease her pain through practicing movements of Qigong and guided meditation.
Through Qigong and through meditation, I can find my soul, and I can sit in that place where there's no pain and there's no stress, because it comes with a lot of anxiety too, and the stress.
Taking pills doesn't work for Shytei. However, Dr. Adam Hanley from the University of Utah has been researching the practice of mindfulness to reduce pain for people who are also taking opioids to treat their pain.
If we can find ways through meditation, savoring practices to sort of teach people how to recreate pleasant experiences in their life, then pain isn't that important in comparison. It kind of shrinks in its significance.
Shytei has been living with chronic pain for a lifetime. She tried everything Western and Eastern medicine had to offer with no relief.
7 years ago, I was done. I'm like, I'm out of here. I'd written my notes to friends and family. I was done, and then a friend said, try one more doctor.
Then Shytei met this doctor that practiced integrated medicine, who helped her find a cause and manage her pain without prescription drugs.
Through Qigong and meditation, I could almost leave my body. And I've experienced the universe that way, in a oneness between all of us, between every living thing. And I've been able to find that transcendent space.
Dr. Adam Hanley and his research team has just completed a study at the Orthopedic Center where patients preparing for joint replacement surgery participate in a 15-minute mindfulness session.
They come in for this, they have this thing called Joint Academy at the Orthopedic Center where the patients talk to nurses, physical therapists, just kind of get an idea of what the surgery is going to be like. And so we do a pain management portion in the last 15 minutes of this 2-hour meeting, and that's all the training they get.
The research team hoped mindfulness would help the patients in the study have improved pain control. However, the end result actually surprised them.
A paper we were just writing for orthopedics, we found that a single 15-minute mindfulness session before surgery improved post-operative physical function outcomes at the 6-week follow-up point.
Christina Kelly-Lecluse is a licensed clinical social worker at the University of Utah Mindfulness Center. She compares mindfulness to a life jacket in a raging river.
With the mindfulness practice and self-compassion, you can then choose to maybe do something differently, think about something differently, and with that can actually change a little bit of the course of the river and slow down the current a little bit.
The key thing doctors and therapists are saying is mindfulness is an effective tool in reducing pain. Sometimes people still have to take pain medicine, but often significantly less.
And there's a record of thousands of years that these kind of practices have been helpful for people in difficult situations.
In teaching people, I see them touch that too. They leave their mind, they leave their body, in a sense. They use their body as a vehicle to touch their soul. And every time I see it, it's a transformative, beautiful experience.
Shytei enjoys Qigong and meditation so much, she's an instructor.
When I do group lessons, group teaching with Qigong, I'll always end the Qigong lesson with a guided meditation. And to see people's faces at the end of that, you know what I mean? They've forgotten about work. They've forgotten about all their stress. They've forgotten about the bills they can't pay. And they are in that beautiful space that is in between breaths.
This is Jeannie Yancey reporting.